Welcome to episode 3 of Walk in Our Shoes, a podcast about working at CHEO during the COVID-19 pandemic. These are brief conversations between CHEO's president and CEO, Alex Munter, and various staff and medical staff. This episode is a conversation between Alex and Sarah Hendry. 10 years ago, straight from nursing school at the University of Ottawa, Sarah did her nursing consolidation training on CHEO's mental health crisis unit. She has been a mental health nurse at CHEO ever since. For adults with mental health issues, 70% of them first have issues in their adolescence. Mental health professionals like Sarah and her colleagues at CHEO, psychologists, occupational therapists, psychiatrists, social workers, and child and youth counselors know that early intervention and support can truly change the trajectory of a person's life.
What made you want to go into nursing?
I had no clue what I wanted to do with my life. I knew I had a passion for health and helping people was super important to me. So I talked it over with my parents and friends, and just the nursing profession seemed to fit my personality. And
what is it about your personality that suits nursing?
I think that I'm just super caring and empathetic, and I have a strong desire to help people.
And where did that come from?
I think all my good qualities came from my parents. I don't know.
Why did you choose to do your consolidation at CHEO?
I thought I definitely want to work with kids. Just please put me at CHEO. I really just want to work with kids. I don't want to be in the adult system. And I came here and I just fell in love with mental health nursing completely. And that's all I've done now since my entire career.
That's so interesting. What was it about the work? Because it's not easy.
Yeah.
It's a challenging environment. What was the light bulb moment when you realized, oh my God, I'm actually good at this?
Yeah.
How did that happen?
My shift was to connect with people, right? It's I had 8 hours and my job was to build a therapeutic relationship and help them and find out what they need and then meet them where they're at and help them.
And when you say meet them where they're at,
Mm-hmm.
For many of our mental health patients, they don't want to be here. So when you're meeting them where they're at may be, who the hell are you and why am I here, right?
Yeah.
So how do you deal with that?
A lot of our patients don't want help, right? And so it's very different compared to other floors where they're sick, they come in, they want to get out, get better, and go home. They don't want help here. It's learning, what are they willing to change? And so you might have these giant expectations, and you just need to find out how you can start small and then big. In
that kind of scenario, where there really gets, I don't want to be here.
Yeah.
You're trying to find the hook. You're trying to find the one thing that starts a conversation, right?
Yeah.
Really? Right?
Yeah.
Yeah.
And I think the whole building a relationship with them, then you can work on what really needs to be done. Is
there a patient you think of or an experience you had with a patient, when they were discharged or at the end of a shift, and you thought, wow, I've really made a difference here in this person's life?
Certainly there's patients that come to mind when you mention that. Yeah, I always feel like it's super powerful in this nursing field people will tell you things that they've never ever told anybody before, and how amazing is that, right? That they've chosen you to feel safest and that they can tell you. So when I think of what you asked me, it's those kind of patients that have told me things I've never told anyone that before, or a lot of our patients come in depressed and suicidal, and they have no desire to live. And so when they can express at the end of their admission, you know what, I think I can do this. I think there's reasons to live. I'm willing to give it another try. That is super motivating.
Mm-hmm. Talking about making a difference, eh? What are the stressful parts? What's keeps you up at night? What do you worry about? What's hard?
It's a crisis unit. So automatically it's every day there could be a crisis, right? Or every moment it could be a crisis. We expect that all our patients have come in the most vulnerable state, and they are in crisis. So it can be unpredictable, right? And so at any moment our patient can go into a crisis, and we have to be prepared to care for them, right? It can be stressful, right? When you're constantly working under crisis.
And how do you manage that? How do you manage your stress?
Yeah, when I first started as a new nurse, right, I'd go home and think did I do everything right? Did I say the right thing? Did I ask the right questions? And you overthink things, and I had a hard time having work-life balance, because I think that's natural as a new nurse, just because you want to make sure you're doing the best, right? But what I realized is doing the best is actually like having really good self-care. And so that when you come to work, you're at your best and you can deliver the best. You know what I mean? Like you're in the right mindset. I just think, self-care is super important, especially with those working in mental health.
Can you talk a little bit about what you've seen on the unit in the last year?
So we've definitely identified that the youth are coming in sicker during the pandemic. That means like they're either more aggressive, their suicidal thinking is stronger. Like as a teenager, it's natural to want to be with your friends and at school and part of all these organized activities. Like it makes it actually more difficult to do it with the masks. Like just pointing that out, we're engaging youth and talking to them, and it's how do you like when you can't express your face at all, it's a bit odd. And so like, are you feeling suicidal? It doesn't come like the same warm when you have a mask and sometimes all gowned up, right? So, and they have to be isolated, right? Sometimes in like droplet context, so they have to be in their room. So talk about you're already struggling, you feel mentally isolated, and then now because we're in a pandemic, you have to be like physically isolated in your room now for your duration of stay when you're receiving support. It's created some challenges. I mean, there's lots of other ways, right? Like in your body language, et cetera, but I think your face says a lot. So
I would love other nurses and nursing students to hear that because as you know, at the moment, and really for the past year, we have had vacant RN positions on 6 East.
Yes.
And it's a challenge for us, right?
It's a very unique type of nursing. Yeah. It's amazing.
This has been Walk in Our Shoes, a podcast about working at CHEO during the COVID-19 pandemic. If you think a career at CHEO might be right for you, see the careers page at cheo.on.ca. CHEO is a global leader in pediatric healthcare and research. Based in Ottawa, CHEO includes a children's hospital, children's treatment centre, school, and research institute with satellite services throughout Eastern Ontario.